Okay? So we're going to visit embryonic connective tissue, alias mesenchyme, and mucous connective tissue, which is also embryonic connective tissue. Mesenchyme, as I said, is the connective tissue that gives rise to all other connective tissues in the adult. Mucous connective tissue, you're only going to find that in the umbilical cord. The umbilical cord, mucous connective tissue. What time is it? It sounds like you're putting stuff away. Okay? Okay, so mature connective tissue. You have two categories, dense connective tissue and loose connective tissue. Loose connective tissue is subdivided into areolar connective tissue, adipose, and reticular connective tissue. Dense connective tissue is categorized into dense regular connective tissue, dense irregular connective tissue, and elastic connective tissue. Whoa, I'm tired. Okay. Okay, so embryonic connective tissue. This is what mesenchyme looks like. I mean, there's really nothing else to say other than it's all mesenchyme, all of it, from here to here. Okay, well, maybe not, because this might be a vessel, and this may be white blood cells. But from here to here is mesenchyme. So these little dots in here are the nuclei of mesenchymal cells. Here's higher power, the same thing. Okay, here's the umbilical cord. And this is only two of the vessels in the umbilical cord. I think there's four. Two for mom and two for baby. 2 arteries, 2 veins for each. And all this connective tissue out here is called mucous connective tissue. Okay, higher power, the same thing. Okay, now this is areolar connective tissue. You have the dark staining, or the light staining thick ones are collagen. The thin ones are elastic fibers, or reticular connective tissue. And all these dark spots in there are nuclei of white blood cells and a fibroblast that makes the connective tissue. Adipose looks like bubbles all the time, no matter where you're at. This is adipose in your salivary gland, and we'll talk about that. Here's some ducts, again, simple cuboidal epithelia. Here's the adipose. And this is glandular epithelia, more adipose. This is your tongue. This is skeletal muscle of your tongue, and you have adipose in your tongue. I told you have it everywhere. Okay, this is really cool. If anybody finds this slide in my slide box, let me know so I could mark it. Because this is a small arteriole that has bifurcated, branched. Okay, and it's really cool. Here it is. So this is kind of longitudinally cut, and this is cross-sectionally cut. Okay, so this is the stomach. So this is simple columnar epithelia right there, and this is the esophagus. So this is non-keratinized stratified squamous epithelia. How we doing? How we doing? Okay, you getting this stuff? Okay. And here's some adipose, because we're really about the connective tissue here. And if we move the slide down a little bit, we can see more adipose. Here's a large artery. This is a lymph node. And this round thing right here is where you have a proliferation of a couple of white blood cells. They're making clones of themselves in response to an infection. And to get reticular connective tissue, remember, your A&P textbooks usually say reticular connective tissue is only in lymph node, spleen, and the thymus, and that's a lie. This is stained specifically for reticular connective tissue, and it's these black lines are the reticular connective tissue. Here's a lymph node that's not stained, but you can only see the reticular connective tissue if you do high mag, okay? So sometimes the vendors give you a slide that says reticular connective tissue, and I look at it, I can't see any. Because you can only see it under high mag, and that's not right. They should have stained it properly. Okay? So here's those round things where you have proliferation of white blood cells again. Here is your brain stained for reticular connective tissue, and there it is. It's not just in the node, spleen, and the thymus. It's even in your brain. Here is somebody's liver with reticular connective tissue. Okay? If I did your heart, we'd find it there too. Here is dense regular connective tissue. Remember, they're kind of like in parallel lines, and you got to use your imagination. Sometimes they're not all parallel, but within each bundle they're parallel. And these dark things in there are fibroblasts that make the connective tissue. Here's more dense regular connective tissue, but it's right here instead. This is really a thick slide, okay? And it's low magnification, so you don't get this architecture. So make sure this is a higher mag than this, okay? And whoever cut this slide had a dull blade because you can see the lines in it from the blade skipping across the tissue. And I know this is dense regular connective tissue because this is skeletal muscle. Here it is, skeletal muscle cut longitudinally, here and here. Here it is cut cross-sectionally. And later on, you'll be able to recognize it for what it is. It just takes looking and more practice, looking. And I can tell, I know it's skeletal muscle because you get these striations on high mag. You find these striations only in skeletal muscle and only in cardiac muscle. So we'll talk about the striations and their physiologic significance in skeletal muscle and heart, and we'll describe that that's where the biological motor is, to move. We'll deal with that later. Now this is dense regular connective tissue, but it's stained with a different color of stain. So you don't try to learn this stuff by color. You can't, because different technicians use different stains. So it's kind of parallel here, there, and everywhere, so you know you're in dense regular connective tissue. And this is what they don't show. The next image is what they don't show in A&P textbooks. This dense regular connective tissue is cut longitudinally, the long ways. Here it is cut cross-sectionally. Okay? You don't see these types of slides in A&P textbooks or microanatomy books. Okay? So they cut it cross-sectionally instead, and it looks like this. And you can't even recognize what it is. But check this out. This is an artery right here, and it's surrounded by dense irregular connective tissue. So you can have dense irregular connective tissue inside of dense regular connective tissue. Dense irregular connective tissue is just about everywhere, except in your brain. Okay? So here is a cross-section of your dermis. Your skin is up here. Okay, this person has a tan. You can tell by the dark staining cells right there. So from here to here is where your reticular connective tissue is, where the white blood cells are hanging out. Now remember, it doesn't look like, I'm sorry, not reticular, areolar connective tissue. Your dermis is in two layers. The first layer is areolar connective tissue, where white blood cells like to hang out. Your second layer of the dermis is dense irregular connective tissue. Got that? I said it right that time. Okay? I catch myself usually, well, just about all the time. So from here to here is areolar connective tissue, and there's the white blood cells hanging out. And then down here is dense irregular connective tissue. But when you get to your skin, instead of calling it what it is, you call it the papillary layer and the reticular layer. I told you these people like to make several different names up for the same dang thing. It makes me frustrated. Okay, but you're stuck with it. I'm sorry. I would have named it layer 1 and layer 2. So all you have to do is know how to count. Okay? Okay, so here is some elastic connective tissue. And by the way, I took all these pictures. Okay? So these pictures are in the slide box I'm providing you. Okay, so this is elastic connective tissue. You're going to find this in your aorta. It's a balloon. Okay? Here is some elastic connective tissue up here, here, and here. But this is not. This is smooth muscle. So this is a medium-sized arteries. And if you could see these little dots right here, those are nuclei of the endothelial cells that are kind of coming off of this histological preparation, and as a result of the preparation. So next time we'll start talking about cartilage.